I'm seeing a lot of happy trends in 2025 in plastic surgery, which is great, of course. One of the things I absolutely love is we're getting back to naturalism, which has always been my personal philosophy. You went through a strange period where you had these overfilled faces and frozen faces and stiff faces, and you want to really preserve the natural identity of the face. Not just the face, but other body areas as well. So there were a lot of overdone breasts, still are. People have had breast implants for a while. Maybe they've gained a little weight, maybe menopause, different things. All of a sudden, this is just an unwanted presence in their body. And one of the interesting things is some of the newer techniques for breast lift you can remove the implants and then rearrange the natural structure of the breast in a way that you can give a beautiful shape to this somewhat smaller breast, but still have it really well balanced visually. There's a particular technique I've been using for over 15 years called the structural breast lift that often does this very well. So that's been a very interesting trend for us. Another thing that's been fascinating to me is some of these new options with hair restoration, to a certain extent prevention. I see that as a big trend because that's part of the total picture when you look at a person. Another one that, of course, can't be ignored in our culture is the role of the GLP type medications, because they have really been wonderful in terms of jump-starting people's health and well-being. But one downside to them sometimes is they work so well that we end up looking a little loose in many different areas, the face, the breast, the tummy. And here's where plastic surgery, again, can come in really, really helpful. Another thing more philosophical is the realization, certainly for me, that plastic surgery ideally is just part of a continuum of things that bring vitality to people's lives. More and more we're seeing these things being brought into our practice and other practices, so it's a very exciting time to be in our field.